Hello, I am Professor Seong-Heui Kim from the Department of Nursing at Daejeon University. First of all, thank you for giving me the opportunity to present at this conference. The title of my article, The Experiences of Instructors Using Innovative Simulation Platforms in Maternity Nursing Practicum, or Qualitative Content Analysis. From now on, let me present my article. The presentation order is as follows. First, introduction. Simulation in nursing education is a technology-enhanced instructional method that provides students with the opportunity to acquire knowledge and skills through lifelike experiences on platforms designed to replicate a variety of potential clinical scenarios. In recent years, the recurring outbreak of serious infectious disease have significantly limited nursing student access to clinical practice settings. Accordingly, the importance of simulation-based practice is increasingly recognized in the field of nursing education. Meanwhile, in South Korea, clinical practice in maternal nurse, which addresses the care of women during pregnancy and childbirth and the postpartum period, is facing increasingly challenging conditions. As of 2024, South Korea's total fertility rate is the world's lowest at 0.975. As a result of these changes, it has become increasingly difficult for students to observe normal delivery firsthand or to provide nursing care to women in labor within clinical settings. In many studies, medical simulations are proposed as educational strategies to provide the trainees with a safe learning environment and effectively narrow the gap between theory and practice before entering the actual clinical field. In the rapidly changing educational and healthcare environment, maternal nursing educators are increasingly expanding the use of simulation-based practicum as an alternative approach to environmental constraints. Recently, innovative simulation-based platforms and modalities utilized in maternity nursing education have diversified into the following types: high-fidelity human patient simulators and virtual scenario-based simulation and VR simulation employing wearable headset or goggles to create immersive 3D hospital world, AI-driven simulation, hybrid simulation, and others. Therefore, maternity nursing educators are increasingly expected to operate advanced technology-based simulation systems. This competence is emerging as a key component of their professional role as educators. Instructors who operate innovative simulation-based modalities in maternity nursing practicum are facing various challenges. However, little research has been conducted to comprehensively understand their experiences. Most existing studies on simulation-based nursing education have employed quantitative methodologies focusing on the learning effects of students. This study aims to explore and analyze in depth the experiences of maternal nursing instructors who operate innovative simulation modalities within the social, educational, and technological context of South Korea. Research method. The inclusion criteria for participant selection were as follows. professors with clinical experience working as nurses in delivery room or obstetrics wards. Those who majored in women's health nursing and hold a doctoral degree. Those with experience in operating innovative simulation modalities in maternity nursing practicum at a nursing education institution. Data were collected in May 2025 through focus group interviews with 7 nursing professors who were conducting simulation-based practice classes in women's health nursing. The interviews were held in the author's university research office. The development of interview questions and the facilitation of the focus group were conducted in accordance with the method proposed by Kruger and Casey. The central research question was, could you describe your experiences of operating innovative simulation modalities in maternity nursing practicum? To address the limitation of generalizability, the interview was concluded when data saturation was deemed to have been reached. Data analysis was conducted using qualitative content analysis to gain a comprehensive understanding of the phenomenon. In order to ensure the validity and truthworthiness of the study, the evaluation criteria proposed by Lincoln and Kuba, credibility, transferability, dependability, and conformability were applied. The researcher obtained written informed consent from each participant after providing appropriate explanation of the study and ensuring that they fully understood its contents. Results. The participants of this study were 7 faculty members who are currently conducting simulation-based education in the field of maternity nursing and educational institutions. All but one of the participants had experience operating 2 different types of simulation modalities, and all were currently utilizing at least one innovative simulation platform. Advanced technology-enhanced systems used in healthcare education to replicate real-life clinical scenarios. The type of simulation used in the maternity simulation classes included not only SPs and high-fidelity human patient simulators, but also 3D virtual reality environments, virtual scenario-based simulations, and hybrid simulation model. The general characteristics of the participants who took part in the focus group interviews are presented in Table 1. Table 1, this. Let me present experiences of instructors operating innovative maternity simulation modalities. As a result of the in-depth analysis of instructors' experiences in operating innovative simulation modality in maternity nursing practicum, 2 categories, 6 subcategories, and 19 themes were identified. See Table 2. The narratives indicated that instructors' experience were primarily centered on the practical and emotional dimensions. The 2 overarching categories were practical challenges in learning simulation and ambivalent feeling toward innovative simulation-based education. See this Table 2. Categories and themes of instructors' experiences with innovative simulation modalities. 2 categories include 6 subcategories. The category of practical challenges in learning simulation include the subcategories of the intense stress related to handling simulation technology, poor infrastructure and administrative support, and difficulties in managing the learning environment. The subcategory of intense stress related to the handling simulation technology includes the following two themes: technical issues associated with operating devices and low confusion caused by unfamiliar multitasking. The subcategory of poor infrastructure and administrative support encompasses three key themes: lack of financial support for simulation classes, physical and psychological burnout due to low overall and poor working conditions, and highly commercialized simulation-based education. The subcategory of difficulties in managing the learning environment comprises the following three themes: strain associated with the maintenance of expensive simulation devices, stress induced by time pressure and unpredictability, and difficulties in controlling student engagement. The category of ambivalent feelings toward innovative simulation-based education include the subcategories of skepticism about simulation effectiveness, recognition of the advantages of simulation-based practice, and reassurance and expectations for improvement. The subcategory skepticism about simulation effectiveness includes the following three themes: perceived limitation of simulation, questionable outcomes, and necessity of a substitute for maternity clinical practice. The subcategory of recognition of the advantage of simulation-based practices includes the following three themes: necessary of a substitute for maternity clinical practice, usefulness in emergency, and out of the difficulties of managing clinical practice. The subcategory of reassurance and expectations for improvement includes the following five themes: motivation through student feedback, finding meaning through student voices, restoration professional identity and self-esteem, growing demand and enthusiasm for embracing innovative educational technologies, design for interdisciplinary collaboration. Discussion and conclusion. This study vividly reveals the challenges and complex emotions experienced by maternity nursing faculties as they conduct practicum sessions using innovative stimulation modality. Within the unique social context of South Korea, currently the country with the world's lowest birth rate, faculty members operating innovative simulation modality in this field experience physical and psychological exhaustion due to unfamiliar simulation technology and operating systems, poor infrastructure and support policies, and skepticism about the effectiveness of policies. Nevertheless, they also report moments of renewed motivation and professional formation driven by student feedback and their own evolving pedagogical identity. The result of this study suggests directions for the development of simulation education and support strategies necessary for enhancing the competencies of simulation instructors. Ultimately, these findings may contribute to providing students with opportunities for high-quality simulation education. Based on the result of this study, the following suggestions are proposed. First, As simulation-based education continues to expand as a core pedagogical strategy for enhancing professional competence in healthcare, where direct access to real patient and clinical practice opportunities is often limited, the importance of developing immersive, realistic learning environments supported by robust technical infrastructure cannot be overstated. To maximize this educational value, ongoing innovation in simulation design and development is essential, particularly in ways that enhance realism and fidelity. Second, the rapid integration of cutting-edge technologies such as VR-based 3D simulations and generative AI for dynamic scenario development has driven the widespread adoption of simulation not only in engineering but also across nursing, medicine, allied health, and psychological training. However, instructors and users without a technology background often face considerable challenges in adapting to these innovations. Given the increasingly complex technological demands of simulation-based education, active engagement from diverse technical fields, such as computer science, artificial intelligence, and biomedical engineering is essential. This study underscores the urgent need for interdisciplinary collaboration among educators, clinicians, simulation specialists, and engineers. Such collaboration can bridge the gap between pedagogical objectives and technological capabilities, ensuring that advancement in simulation technology are effectively aligned with education goals. Ultimately, fostering a synergistic partnership between education and technology will enhance both the quality and long-term sustainability of simulation-based learning in healthcare. With this, I finish my presentation. If you have any questions, please send email at this address. Thank you for your attention.